Well, unfortunately, a lot of adults suffer from depression. By estimates, I think the number is around 7% here in the United States.
Kids and teens can also suffer. It's important to know what to look for and to know help is available.
From OneWorld Community Health Centers, Dr. Gloria Gonzalez-Kruger is here. Thanks for stopping by, Doctor.
Nice to see you.
Thank you. It's good to be here.
Would you explain something for us? Explain the difference between behavioral and mental health.
Well, when I think of behavioral health, I'm looking at the kinds of behaviors that allow us to have a satisfactory life, good eating, good sleeping habits, good social relationships, those kinds of behaviors that we make choices about.
And
then
mental
health is more about, it's still related to behaviors. But if behaviors, like say for example, smoking, that is a choice that we make, we start smoking, it's a behavior, it's one that is what we classify as an unhealthy behavior because it can lead both to physical and mental problems because it can become an addiction. And it's a physical addiction, but it's also a psychological addiction because it becomes a way of coping with thoughts, feelings that may be disturbing.
And that's the mental health.
Yes, that's the mental health component of it, yes.
Yeah, and then the services that you offer at OneWorld Community Health Centers, though, there's a whole realm of them.
Yes.
But when you talk about mental or behavioral, can you explain those services?
Yeah, we have a range of services, and I think one of the important components of OneWorld services is that behavioral health is working with the medical providers because medical and or physical and mental and emotional and relational kinds of health are all connected. And if you are having, for example, diabetes, you're more at risk for depression. If you are struggling in school, you're more at risk for depression, anxiety, high stress, which affects our physical health.
I think it's good to have you here to share with the parents, the caregivers, the guardians who are watching now. They want to keep the kids and teens in their lives healthy. So what can they look for, the signs and symptoms early on, so they're getting the help needed?
Well, I think the signs and symptoms, we're going to start from the very beginning, you know, birth, toddlerhood. You're going to know your child, and you're going to have develop the kind of relationship with them by being involved with them, so that if there is a change in behavior, you will notice it as a parent. And so if a change in behavior that causes problems for the child's relationships, school, relationships with parents, they're no longer interested in doing things that they used to enjoy doing, you see them sad, hopeless, and sometimes they are crying a lot, and other times they're just kind of numb.
May I ask if it's, some parents might wonder, if this is just a phase. So how do you know if it's that or if it's something more serious?
If it goes on for more than a period of 2 weeks, then the child should really be assessed. During those 2 weeks, hopefully you have tried to talk with your child, identify, you know, is there something that's a situation that is triggering these kinds of feelings or thoughts or behaviors. But if after 2 weeks you still see that sadness, hopelessness, sometimes it's irritability and anger. So some kids go to one extreme of the sadness and hopelessness, and then others go to the other extreme of showing anger, irritability, aggression, acting out. So some are acting in, others acting out.
It can vary from child to child, but is there also a difference in terms of the symptoms that you look for from a younger kid to maybe a young adult like a teen?
Yes, for example, all of those things that I mentioned could be in adolescents or children. However, with teenagers, you're more likely to begin to notice serious acting out behaviors. The children's, you know, maybe they don't want to play with their kids, they're not sharing, et cetera, et cetera. But with teenagers, you may be hearing them preoccupied with death and dying. You may see them completely withdraw from groups that they used to be involved with. They have no interest in anything. They have a higher tendency to be irritable and angry, and so then they begin to drink, they begin to do drugs, they begin to, you know, not engage with their parents in the way that they did before. And so it's really important because the consequences can be so much more serious with the teenagers, because the acting out becomes more serious.
I said before our visit started, we wanted our viewers to know what to look for, and we wanted them to know that help is available. So in a minute, if you could tell us how our viewers can take advantage of what you offer at OneWorld.
Well, medical patients are always have availability, access to behavioral health. So we will go right into the exam room after your doctor visits with you. Either the doctor sees something, so the doctor calls us in, or the patient can ask for a counselor to come and talk with them. So then that's a 20-30 minute session. If they want to return, we can schedule those outside of a medical visit. And then we also have what we call traditional therapy. So the follow-up care where they see us weekly, every other 2 weeks, once a month, whatever it is that they need. We also have substance abuse, we have psychiatry, we have social work. That's all within the behavioral health department.
A lot of
And
services.
part of this is parents and guardians just don't know where to turn. And so OneWorld Health, that's a start. You start right there.
Absolutely.
And you're about access, which is your entire mission. So to
Yes.
think, just make the call, log on to learn more too. It's oneworldomaha.org.
Absolutely.
Thank you.
Thank you
We
so much.
appreciate your time.
All right, so did you catch Gary Owen's Showtime special? It's called I Agree With Myself. It was just released earlier this year.
He's had a few big movies out too. Why Gary thinks his stock's so high right now. He'll join us next.